China. Within this 15 days or 20 days of time, I say 31st of December, we have reported one case, and from there 17,000 cases have been reported from China alone and 150 from rest of the world. Now the world is moving very fast, interconnection is very much there. So the situation is grim because number of cases are increasing day by day, and that 360 deaths are there. And it is a very transmissible virus. It means transmission rate is high. So that's why this is a problem. 2%, but if the transmissibility is very high, if in this short period of time is become so high in transmitting the infection, so 2% will become very high because the number of people affected will be more. So if the number of people get infected more, so 2% becomes very high. Solution at present, we should know the facts. The facts is, normally whenever the virus or bacteria enters into the body, we have some antibacterial drug or antiviral drug. This is a virus infection. Coronavirus is a virus infection. Right now, whatever research have happened, there is no antiviral drug which is effective against it. So there is, and secondly, there is no vaccination. So two things have to be kept in mind when we're talking about the short-term solutions. So in that case, it becomes only thing remains is a preventive. And those who are having infections, for them it's a symptomatic treatment. They should report as fast as possible to the medical professionals, and that to qualified medical professionals. Because we are finding some news that this can be cured through some homeopathic drug or allopathic drug or some Ayurvedic drugs. Right now, everybody has to understand, as per the WHO statement, there is no as such a complete treatment for this virus. Only treatment remains is a preventive treatment, and secondly the symptomatic treatment. There are symptoms of this virus is, before we say that why it should be kept isolated, is we should know the symptoms. Symptoms in these cases are cough, fever, running nose. What happens is when we cough, another thing we have to keep in mind is everybody must have read that it is through the seafood it is happening.
Has that been confirmed?
Yes, it has been confirmed that it is from the seafood, because the number of cases which has come, if you see the original doctor who has seen this case, he saw that there is a patient who is coming for running nose, cough and some little bit of breathing problems. And then he found that the next day 3 or 4 patients from the same family has come. Then he traced down from where this common receptor is there. He found that this has come from a market they were visiting. That was seafood market. So, and it has been known that coronavirus is mainly present in bats. So from there, probably the reason is that snake has become a reservoir in this. So snake has come in between. From snake to human has come. The biggest issue now is that this is now the animals are not required, seafood is not required. It's a human to human transmission is there. That is a problem. If it is from animal to human being, that's fine. Then you can restrict it. But once it becomes human to human transmission, and that too through a mechanism which is airborne. So when the infection is through an airborne, it becomes more infectious, because when we infectious, one is through the air it goes. Second is when we vomit, when we cough, everything which comes out from the mouth, it is on my surrounding, it is also settling down, and it is not killed straight away. When it comes to surrounding, it survives in the surrounding also. Some estimates are there, it may survive up to 5 days in the surrounding. So wherever I am touching, and somebody has come and he has coughed and you are suffering from this kind of a fever, and I come over there, or any person comes over and touch those surrounding, from the hands, it take away those viruses. And once this virus comes over to my hands, and I put into nose or in my throat or in my eyes, and through these things also it can transmit. So it becomes a very problematic thing. The transmission rate, that's why it is high, because it is invisible way of transmission. Because it is difficult to wear mask all the time. One. Second, the mask has to be which is tightly fitting into your mouth and nose. What happens is, they are mostly masks are there, they are cosmetic in nature. You just apply it and you find from the side and from this side, there is a lot of entry points are there. If this virus enter through these points, then obviously one is not going to be helpful in this case. Secondly is that we are using this mask in a mask campaign. What happens is you have put the mask and it remains for a longer period of time, but once it is wet, it becomes useless. And secondly, I am putting my hands on the front of this, and this front of the mask contains most of the viruses, because every virus which is coming over here, it is sticking to it. What happens if I'm keeping it for a long time and go home? What I have seen is people are putting this mask, and whenever they come home, they put it down. So what happens is when you put it down, the front side becomes down. It comes on your shirts, on your clothes which you are wearing, and then you touch these finger with your fingers, and then it goes. So important way of preventing this will be only a hand washing. Very, very important. We must have a hand washing. Person who is supposed to be having infection, he should wear mask so that he is not spreading it. And the person who is having this fever, we should now at present, we have the facilities in our country also, wherever they are, it should be kept in isolation. And the important point in isolation is it has to be under negative pressure, so that whatever he or she breathes, it should not come into the other rooms or in that room. It should go outside the one. It depends upon our people also, how much they understand it. Where we kept it 647, but right now the figure is 3% still have got that infection, and these 3 can transmit how many we do not know till if we do not take all the precautions, and we do not know how many have come. 647 of the people whom we know have travelled back to our country under control, but there are many who have come before that, and it is a long incubation of 14 days. And the problem also is within this 14 days also, if we talk about incubation period, the incubation period means is the virus enter into my system, but it is not giving any kind of symptoms to me. After 14 days, I will come to know that I am having such kind of fever. But during this 14 days also, I am transmitting infection to others. The person who is infected, he is transmitting this infection to others before he gets the symptoms. So that period is a long period and a very dangerous period in that sense. So at present, we cannot be complacent. We cannot say that we have evacuated 647 people, so we are safe. No, we cannot be saying that we are safe. And second, and because before that so many people have come without notice. Secondly, there is another kind of people who have not come from China, but they are coming from rest of the world to India. The word, wherever you say, word has become global. I think more is required. You said government is doing, but with a huge population, I see that these things is not percolating down the line. So we have to educate our medical professionals. We have to educate our masses, but I still feel that it is not enough. Our media, I will say, newspaper are doing a good job. Every day on a headline it is there that so many people are affected or not. But unfortunately, I have not seen much in the media, in the government media side, or all these pamphlets which are there. We should be doing more. Because if it comes, then we have a problem. Like China, we have a huge population density. And this is traveling from one person to another by means of, I will say, contact, because my hands are touching everywhere from this way, and second, the respiratory. So these two things are a huge problem wherever we have a population density. So China, that's why China has had more number of cases, and if India comes into that also, we will also have, unless and until our people are get educated, people are aware. So I feel more need to get one such program which we are doing today. I think these are required more frequently. China, I think in that period nothing has been done. No country has done such kind of. One good point is that though being a communist country, China has come out openly for this. So we appreciate the effort of Chinese government, which always they curb those things. But today We appreciate that they have come out. So I only see the bright spot here is China is coming forward in giving the information.
Even WHO is involved.
First, the local government in a country has to come into picture. They report to the WHO. If suppose anything happens in the country and WHO, we do not inform WHO, how the WHO comes to know. And now, yes, WHO has always come forward whenever such calamities have happened, such epidemics have happened. They are always very fast in coming out about the preventive measures and all those things. Because of the WHO, only we are coming to know that 150 people outside the world are also outside China are also affected, and only through them their research team is working on the vaccination part in Australia and some other countries where WHO presence is there, and they are working fast on this. Some pharmaceutical companies are also working on production of a vaccine procedure. What happens is, for a production of a vaccination, one is we have to do the genetic coding of that, which we have done. Then we have to replicate that virus or a bacteria into a laboratory, which has happened. But then it is a trial which has to be done. Even today, if we talk about a vaccination and it becomes, and then these trials, what is these trials are? These trials are, what is that part of a virus which will produce antibodies in me, so that if a virus attacks me, it is not effective. So it is a long process. We do not know which part of the virus is producing that kind of a protective antibodies. So if even we are successful in replicating that virus today, but trials which will happen minimum of 6 months will take. So in this 6 months is a long period. I said that it is a very highly transmissible virus. So this 6 months, only thing left with us is precautions and nothing else, because there is no antiviral drug at present which we can control with this. So only controlling method with us is precautions, that too hand washing and taking care of your surrounding areas, taking care of the patient who is there, taking all those precautions in treating, rather I will say today, reporting that case fearlessly to the government, to the health authorities, so that appropriate action can be taken. If around 58 people in Kerala are being watched under observation.
Community surveillance.
In the community surveillance. So these kind of things are very important. But this can happen when the few cases are there. But if it become a large cases, you know.
So hospital quarantine is important only when you
develop symptoms, because before that you do not know. But before that, if the contact history is there, like the people who have come from China, our students, most of them are medical students, 640 odd around number, they have been put under quarantine. They don't have any symptoms as present. But because of a long 14 days incubation period, and during that period they can transmit to others. So 14 days they have been not in a hospital, but in another environment where they will not be able to meet other people outside the world. So this is one. But as soon as the symptoms develop, you have to be in a hospital, in a quarantine, which I said, ideally it should be a negative pressure room, where your air, the patient air is not going in the other parts of the hospital, it is going out in the environment.
But
in 10 days time, they said 10 days, but within 9 days, they have been able to build a hospital of not one bed,
so
100,
that kind of
1,000 bed hospital they have been able to build. So that is really an appreciable things about China. The rest of things we do not know, but as the things will come. But as things stand today, we must appreciate the effort of Chinese government, that they are forthcoming with the information. They are building up hospitals, and I've heard that another hospital is in the pipeline of 1,000 more bedded for the patients. So good things have happened, and we hope that as our Indian government is also working on that, we'll be able to curtail this virus, and it will, whatever 3, 4 patients have come to India, probably this number remain this only, and we'll be able to do a good job. And prevention. So hand washing, the most important thing, and your surroundings. Clean your surrounding, keep your surrounding hygienic. Waste disposal is also very important. You properly dispose of. Our Indian habit is we throw garbages anywhere in the environment, and this garbage is if they contain these kind of viruses or bacteria, they multiply in the environment. They do not need high-fi things for their survival. They just need moisture, some carbon, which is available to them wherever the waste is there. So, proper management of waste, hand hygiene and hygiene of surroundings. And plus the alertness on the part of the patient whenever they have such symptoms or at present the history of contacting such kind of patient, they should report immediately to the health authorities.
Thank you. Thank you so much.
Thank you.